Hello, my name is Michaela Knuckle, and today we are going to talk about Ernestine Weidenbach. I hope I said her name correctly. Her nursing theory is called the helping art of clinical nursing. Ernestine Weidenbach was born in 1900 in Hamburg, Germany, and her family moved to New York in 1909. She earned a Bachelor of Arts from Wesley College in 1922 and her registered nurse's license from the Johns Hopkins School of Nursing in 1925. She got her Master's of Arts from Teachers College, Columbia University in 1934. In 1946, Weidenbach earned a certificate in nurse midwifery from the Maternity Center Association School for Nurse Midwives in New York, and she taught there until 1951. In 1952, she joined the faculty of Yale University as an instructor in maternity nursing. She became an assistant professor of OB nursing in 1954. When the Yale School of Nursing established a master's degree program, she became an associate professor and was the director of the major in maternal and newborn health nursing. She published Family-Centered Maternity Nursing in 1958 and Communication, Key to Effective Nursing in 1982. At the age of 97, Weidenbach unfortunately died on March 8, 1998. So, as said previously, Weidenbach's model that we're going to discuss today is the helping art of clinical nursing. So in her model of nursing, she explains that nursing is the practice of identification of a patient's need for help through the observation of presenting behaviors and symptoms, exploration of the meaning of those symptoms with the patient, determining the cause of the patient's discomfort, and determining the patient's ability to resolve their discomfort, or if the patient has a need for help from the nurse or other healthcare professionals. The theory stresses the importance of the nurses' and patients' perceptions and how these perceptions drive care given to patients. Weidenbach's theory identifies the patient as any individual who is receiving help of some kind, be it care, instruction, or advice from a member of the health profession or from a worker in the field of health. A patient is any person who has entered the healthcare system and is receiving help. This means he or she does not need to be ill to be qualified as a patient and to receive help. A person receiving health-related education would qualify as a patient as well. So, going on, her theory identifies four main elements in clinical nursing: a philosophy, a purpose, a practice, and the arts. The nurse's philosophy is his or her attitude and belief about life and how that affects reality for him or her. The nurse's purpose is that which the nurse wants to accomplish through his or her actions. It encompasses all of the activities directed toward the overall good of the patient. The practice of nursing consists of the observable nursing actions affected by beliefs and feelings about meeting the patient's need for help. The art of nursing includes understanding the patient's needs, developing goals and actions intended to enhance the patient's ability, and directing the activities related to the medical plan to improve the patient's condition. So, the purpose of the theory is to facilitate the efforts of the individual to overcome barriers which currently interfere with his or her ability to respond capably to demands made by the condition, environment, situation, and time. The nurse will have thought the kind of results he or she would like to see and will take action to obtain these results, affecting accountability for what she does and for the outcomes of her actions. So, how is Weidenbach's theory used in nursing practice? Her theory is utilized every day by nurses when providing care to patients by assessing patients in the context of personal nursing philosophy, evaluating and planning care for patients based off their healthcare perceptions and need for help, providing education, referrals, interventions according to philosophy and knowledge, and validating care given to patients is appropriate and consistent with intentions. I hope this video was very informative, and thank you for watching.